You are watching the DocTalk show.
So prostate cancer is one of the most common cancers in males. It only occurs in males, never in females, by virtue of the fact that the cancer cells depend on a male hormone called testosterone. We have learned that by depriving these cells of this testosterone through medical interventions, we might be able to control the spread of cancer, in this case metastatic cancer. Dr. Mohan explained that with the more definitive options include surgery or the use of radiation, but that is only for cancers that are limited to the prostate alone, that haven't gone beyond the prostate. So if it is metastatic cancer, we can use the treatments that will starve the cancer cells of testosterone. But we want to explore a bit about this radiation, the radiotherapy you're talking about. Is it available in the country?
At this point, external beam is available, IMRT isn't. It should be a major focus for the Ugandan government to get it going shortly. At this point, radiotherapy is still in the realm of federal medical service, not in the private sector. Considering that cancer prostate is the commonest male cancer age greater than 45, and there's a large burden of disease in this country, it is an area that the government needs to focus upon to enhance the availability of this modality.
Treatment services for the
Absolutely.
cancer. Because it's not only prostate cancer, it can be used to treat other types of cancers.
IMRT possibly will enhance the treatment of every cancer, especially head, face, neck, cervical cancer in the female, which is the equivalent of the prostate cancer. It does provide significant benefit. External beam is available, it is doing its job, but IMRT will provide a far
better option, better outcomes.
Significantly better outcomes with much less side effects.
Okay, so I'm sure the people responsible have taken note of this recommendation to have a functional radiotherapy unit within the country. So talking about the cancers and the treatments, in this case we're discussing the metastatic cancers which need the medical therapy. Are there instances where it can fail to respond?
In all instances, as I say, the cancer cell is a smart cell. Like we use the phrase survival of the fittest as the evolutionary basis for the human race, the cancer cell also evolves.
It evolves and changes itself.
Yes. To survive without testosterone. We call this small clone of cells as hormone-resistant prostate cancer, or HRPC.
Hormone-resistant prostate cancer. So essentially it's resistant to the hormone.
To the hormone. So the whole plan which we have of medical or surgical plus medical castration fails. This small group of cells rapidly expand because the other cells which are testosterone dependent will die, the brothers will die. This one fellow who has modified himself will multiply. And then you find a sudden increase in PSA and the disease activity increases. Typically in the African race and the Afro-American component who have cancer prostate, this tends to develop early by 3 to 4 years as compared to say the Caucasians where it develops between 5 to 6 years.
That is the years on the medical
subsequent
treatment.
To initiation of maximum androgen blockade for metastatic cancer prostate, at about 3rd, 4th year mark, 1/2 of the patients of African origin may develop HRPC. And the same will happen to 1/2 by 6, 7 years in the case of Caucasians, and in 1/4 of the Indian and the Chinese who develop cancer prostate. It's very important that information about the cancer. What should you do to protect yourself? How do you approach if diagnosed with prostate cancer for yourself or a loved one is of critical importance. Where do you need help? Where do you seek help? And what do you do when help is not available in the location you are in?
Like they say, prevention is always better
than cure. And if it is hormone-resistant prostate cancer, then we treat it with newer drugs, basically chemotherapeutic drugs. There are many drugs like enzalutamide, abiraterone, and they are extremely helpful in this situation.
Okay, so much as we can we're at risk of getting the hormone-resistant cancer, there's still treatment available.
There is still
for it.
treatment available.
Is this treatment available in Uganda?
Yes.
Okay.
Most of these drugs are available. They can be administered locally. And although at this point they're expensive, they tend to restore the control of the metastatic cancer to where it was prior to the hormone resistance developing. So it does provide both quality and quantity of life, restore it to where it was prior to this clone of hormone resistant cancer cells developed.
So it establishes some sense of control
Yes.
to the disease process.
Yes.
Okay, let's keep in mind this is a metastatic disease. So
Correct.
the treatment will not achieve cure, but to help
It will
control the size and the
Yes,
growth
it will
of
allow the
cancer.
patient to continue to need a near normal life, independent life, with the help of these newer drugs.
Okay. How best can one prevent this cancer?
The number one thing beyond the age of 40, if there is a family history of another male member having suffered from this cancer, or age greater than 45, a yearly PSA measurement would be the single most logical way to know if you have the problem.
That is the blood test, the PSA.
The blood test
that
serum
measures-
PSA, once a year, annually, once.
So you recommend all men above the age of 40 or 45?
To get a serum
Should have
PSA
that
once
blood
a year.
test.
And in case it does turn out to be on the higher side, then to appropriately get yourself investigated, because it could well be prostatitis infection. It could be a very large benign enlargement of prostate, age-related enlargement. But odds on, if you find a high PSA, getting it thoroughly investigated is the way to prevent a future problem.
Okay. So prevention, always all men out there above 40 years or 45 years of age. I think it should be regardless of whether there's a positive family history or not.
If it is positive family history, probably age 40 you can start off.
But you should start even earlier.
Yeah, otherwise age 45 is a good cutoff.
Okay, so if you are a man and you're aged above 40 years and you've had a male relative in your family who has ever suffered from prostate cancer, please go to the hospital and have a check for your blood PSA levels. That will help us tell, it is a screening tool to tell us if you might be at risk of prostate cancer.
Absolutely.
And if you can get early cure, because we have learned that early disease has no symptoms. The best is to look for the disease and to cure it.
Cure it. And that is the single best take-home message that we can provide today. That you can't prevent it, but you can pick it up early. You look for it because there are no specific symptoms. And if you do find it, get it appropriately treated at the earliest. That is the significant take-home message that has to go across.
Okay. So we have discussed prostate cancer at length. You were listening to a senior urologist. That is, a urologist is a doctor who specializes in the medicine of the urinary tract. And he has extensive experience in prostate disease, particularly prostate cancer and benign prostate hyperplasia. You can find him at Novick Hospital, where he makes periodic visits. And the take-home message for you all is any man who is above 40 years of age, you might be at risk of a prostate cancer. Being African puts you at a very high risk of getting this cancer because of the too much testosterone we have in our bodies. So you must go to the hospital and get a PSA test. That is a blood test done to check for prostate cancer, after which you will be thoroughly investigated and treated and managed accordingly, effectively. So thank you for watching the DocTalk show. I am your host again for the night, Dr. Darius Owachi. Please send in your comments or questions to the social media platforms, that is on Facebook and Twitter, and our doctors will respond to your queries. Join us again next time on the show.